Hello and welcome once again to Spring Clinic on Western Spring Television. I am Daniel Emeka. Spring Clinic is brought to you in partnership with the Office of the Chief Medical Director, Union Teaching Hospital. Today on Spring Clinic, we'll be looking at a critical topic, child health and nutrition. Child health, of course, encompasses everything concerning a child's well-being, which includes physical, mental, intellectual, emotional, and of course, social development from childhood to adolescence. And today on the show, we have a special guest joining us. I will be unveiling our special guest right after this break. Please stay with us. Welcome once again to Spring Clinic on Western Spring Television. Don't forget you can view this live on our YouTube channel, Western Spring Television NG. Today on Spring Clinic, we have a wonderful guest joining us, a consultant pediatrician, Dr. Tosin Adeniji from Union Teaching Hospital. Hello, Dr. Adeniji.
Hello, good afternoon. Thank you for inviting me. I'm very excited to be here this afternoon.
It's a pleasure having you.
All right, you're welcome. See me.
So today we are looking at child health, and a critical aspect of child health we'll be looking into is nutrition. But let us start with child health. What is child health, and what are the factors affecting child health?
All right, thank you for that question. As you've rightly said earlier, child health deals with everything that affect the social, the physical, the social, emotional, psychological state of well-being of a child. So anything that affect the wellness of a child, that's what we refer to as child health. So a child is somebody from age 0 till adolescence. Do you understand? So it's not just a state of absence of disease, but even a state of well-being of a child. And then the factors that affect it, although our focus today is on nutrition, which is a critical factor that affect the nutrition of a child, but there are many other factors that can affect the health of a child. One of it is the genetics, that is the kind of genes that a child inherits from the father and the mother. Can affect the health of a child, the environment in which a child is growing. For example, availability of the housing, the shelter, the food, the water supply, and different things like that. They all can affect the health of a child. There are cultural factors, there are food taboos, and some cultural influences that affect the health of a child. So also some religious practices that people practice, they can either influence the health of a child positively or negatively. Level of education, if a parent is well educated, they are likely to cater for the child better. The child is likely to be in a better state of health. And when a child, the parents are not well educated, it can also affect the health of a child negatively. So these are some of the factors that affect the child's health.
All right, Dr. Adeniji, excuse me. Let's now go to the crux of the matter for today.
Okay.
Let's start with what is nutrition. How would you define nutrition as far as a child is concerned?
Okay. Nutrition generally has to do with the process by which nutrients, food containing nutrients, are taken in, the process of ingestion, absorption, and the utilization in the body. So the process by which you take food in and then it gets into the body, get absorbed, and then it functions in critical things in the body, such as functions of growth, repair of body tissues, such as functions of growth, repair of body tissues, and different other activities that food is expected to do in the body. So all these processes are referred to as nutrition.
All right. So, Dr. Adeniji, what are the critical factors, critical nutritional needs of a child in this context?
Okay. Well, the critical nutritional needs of a child are, number one, if we can't talk of critical nutritional needs of a child, if we don't talk of the major classes of food.
All right.
So, generally, we have two major classes of food. We have micronutrients and we have macronutrients. Those macronutrients are required in large quantities, and they include carbohydrates, proteins, and fats. While the micronutrients include vitamins and minerals. The other one is water. It's also a major class of food. So any food that you give a child must contain all these 6 classes. Now, depending on the age, we now determine, the age of the child will now determine the form that you're going to give the food. For example, now, in the first 6 months of life, we talk about breastfeeding. The gut of a child is not matured. A baby that is newly born is not mature to handle adult food. So such a baby needs to be fed with breast milk, because breast milk contains, is a kind of pre-digested meal. It's already digested, as it were, to some extent. So the gut of a newborn can easily undo it. And that's what they require in the first 6 months of life to supply all the nutrients that they need. So after 6 months, they get to a level that their gut is now mature. They can now undo some adult diets.
Like solid food.
Yeah, solid food. So you begin to transit them gradually to adult diets. So usually it should be a gradual process. You can't do it suddenly.
Yeah, you have to start with semi-solids.
Yes,
maybe something like,
like pap.
Cereals, pap.
Okay, cereals generally, like pap. Even the, you won't give them, for example, now, you can't, a child that is just transitioning from breast milk, you can't give cereals directly. It has to have been blended. For example, pap is blended corn.
Absolutely.
If you are giving rice, it has to be blended to a kind of a state that it will be semi-solid, not just grains of rice, because they may not be able to take it at that time. But after they get used to the semi-solid, then they get transited to the normal solid food.
All right, Dr. Adeniji. UNICEF advocates that children should be fed with breast milk exclusively for the first 6 months.
Yes.
But there is one more thing, Dr. Adeniji. One particular one that caught my eye is breastfeeding in the first hour of a child's birth. They say, according to a UNICEF report, they say it's very crucial for a child to be breastfed within the first 1 hour of the child's life. But majority of children do not get to experience this. They do not get to enjoy it. What do you think are the major causative factors? And another question for me is, what if the milk has not started flowing at that time? What can be done to stimulate it?
All right. Thank you for that question. The recommendation is based on the fact that when a baby is newly born, the blood sugar tend to, it starts coming down, and it reaches the lowest level between 1 to 3 hours of life. And when a child has a low blood sugar, for example, we call that hypoglycemia. It may not even show. The child may appear apparently healthy. But the problem with that is that the child might have experienced some damage, especially to the brain. If a child has hypoglycemia and is not attended to, it can affect the brain, and that can affect the child for life. So that's why that critical 1 hour is there, that baby must be fed immediately after birth, as soon as possible, within 1 hour of that. Some talk about 30 minutes that you should put a baby to breast. And during this time, even though some mother may not have been breastfeeding, but you still put. Do you understand? Because even the act of putting to breast will stimulate.
Yeah, you know, that's why I asked that question. That what if the milk isn't flowing yet at that time? Is there anything that can be done medically just to stimulate it, or you just wait for the natural cause?
You put the baby to breast.
Okay, so it happens naturally.
It happens naturally.
It doesn't require any stimulation.
It's only occasionally when they now need. There are some special cases. I say this with all sense of caution because we don't encourage people to go and be giving breast milk substitutes, that is infant formulas, unless it is indicated. So there are cases where it is indicated, but 1 hour is too early to conclude that somebody is not lactating. So whatever comes out, the breast milk at that early stage, within the first 3 days of life, is not going to, we call something colostrum. Colostrum is the initial breast milk that the mother produces. The volume is usually small, but it's very rich. That's a lot of antibodies that protect against infection. That's a lot of things that will help the baby. And we should not deny that baby the opportunity of getting it. So it may be very small, but it's very rich. So we still encourage them, put to breast. Within that, and it concerns the feasibility of that. A lot of people, if you are intentional about it, you can do it. Even somebody that has just gone through CS, there is a way, if they are well supported, they can do it.
Yeah. So is the problem now ignorance? Because according to that UNICEF report, over 50% of children do not get to experience that. I mean, being breastfed within the first 1 hour of their life. So should we attribute that to maybe ignorance on the part of the parents, the mother? Or you can't really blame the mother, she just put to bed. So is it on the part of the healthcare workers, or where is the disconnect coming from?
Well, I would say it is multifactorial. We can't totally put the blame on the healthcare worker, even though the healthcare worker is responsible to disseminate the information to the mothers. In fact, as a matter of fact, it's part of things that should have been emphasized during the antenatal clinic. So, but in this environment, for example, a lot of times you are still catering for the mother. Some mothers develop complications. Maybe he was referred to the hospital. He has gone to another place to deliver, and where she's not well attended to. And then he's just being referred to a teaching hospital or a higher center. That kind of people, they are struggling for the life of the mother. So nobody is interested in the baby.
Yeah, the mother is even separated from the baby at that time.
So a lot of time, that may not even make it to be feasible. So even if they have all the knowledge and everything, the fact that mother is dying, or they are trying to cater for the mother, make them forget about the baby. But I believe that with more education, educate the mothers during antenatal clinic visits, and then they should be supported. Somebody that just delivered, it may not be easy to just start breastfeeding just like that. They need the support of the nurses. They need the support of the relatives. They need the support of as many teams as possible so that they can initiate that breastfeeding at that time.
All right, Dr. Adeniji. According to medical research, the first 1,000 days of a child's life, that is starting from conception to age 2, is crucial in the healthy development of that child. Now we've gotten the fact that for the first 6 months, it should be breastfeeding exclusively for the child, except in special cases, like you said, when the mother is not lactating, that's when they can use supplements. So after that first 6 months, let's now go into nutrition and feeding after the first 6 months.
6 months of life.
Exactly. So what is the best way to feed the child, and what are some of the challenges being faced, especially here in Nigeria? What are the common challenges you see as a pediatrician when you see children who are malnourished?
Okay. Do you mean challenges with the baby or with the...
Yeah, not the baby. Yes, what are the challenges the baby might come down with? That's on one side. And again, what are the factors affecting? Okay, let me put it this way. What are the factors affecting malnutrition in infants from your own experience?
Okay. One of the factors, I would still say the ignorance we mentioned first time is very relevant here. Most people don't even know what to do. Most people don't know what to do. They don't know the kind of food because there are a lot of food. For example, if the mother is a working mother, is not readily available, there is tendency to give children maybe some fast food, give noodles, give all kind of food that may not really be what the child needs. That may not that it's not what the child needs, but it's not supplying a balanced diet. And there's some food that once you give a child, that's what they will be craving for. And that one will not satisfy their nutritional needs.
But the child has developed interest in that particular food.
So that's why that period is very critical. That's the period that you are transiting them from milk to adult diet. So you need to do it. You need to know what to do. And you don't need, even though poverty might be a significant factor, but even when people are poor, there are cheap feeds that they can introduce for their children that they will still be able to afford. And generally,
Doctor, some people are really poor. I mean, like poor, like broke poor. because because we're still going into the classes of foods where we have to. I would like us to take one. I mean, after the other, each of them, look at them and the examples of those foods.
Okay.
And let's see how cheap they are according to you. Because I know some people can really be poor, and we'll look at each of them and the substitutes just in case they cannot afford the standard one.
Okay. So generally we talk about cereal-based diet. When we talk of cereals, example of cereals include maize, rice, wheat. All those food substances are cereals. And of course, in our own environment, we also have things like guinea corn, popularly called dawa, and then millets and things like that. So all these are cereals, and any of them can be used. In fact, you don't need to use too many of them because they all contain relatively similar nutrients. So anyone is good enough. But if you want to use different ones, it's because you don't want the child to get used to one particular taste. So if a child does not like maize, he will like rice. If he doesn't like rice, he will like wheat. So based on that, you might want to introduce various ones. But in our environment, maize is very common, guinea corn is very common, and that's fairly good enough. And I think it's relatively cheap, at least cheapest among all the other options. So what you do is that, like I said earlier, you grind it, make it a form of semi-solid feed. So for example, if you take maize now, you can give as pap. And this pap initially must not be too thick. Make it light so that the child can take it. Maybe with time, you might prefer it to be thick, but at least make it, don't make it a little bit watery. Not like water, but at least
so something close to like breast
milk, yes. So that the transition is smooth. And then this cereal should not be taken plain, should be added with a legume. For example, you can add milk to it. You can add beans, soya beans.
That's adding other classes of food.
Yes. So if you are giving rice, you can add beans. You can add soya beans with dawa. Do you understand? So just those combinations like that. Sometimes you can even add oil. just to, that oil will strengthen the nutrients.
Doctor, there are so many different kinds of oil. I mean, so what kind of oil? And oil has grades. I mean, you see some extra virgin olive oil, which is quite premium, quite costly. Then you see the normal vegetable oil. And so what kind of oil is recommended? Anyone?
Anyone.
Okay.
Palm oil is very good because it's also rich in vitamin A.
Yeah, absolutely.
Yes.
Okay. So apart from cereals, doctor, so let's quickly look at the other classes of foods now. You've talked about cereals, you've given examples, maize, wheat, rice. Exactly. So what are the other classes of food and their examples?
Okay. Other classes of food like proteins. We have meat, fish, beans. Even though beans it also has a high amount of carbohydrate too. Because people assume that.
Yeah, people assume. Even myself when I was young, I thought beans is just pure protein. Like
so, not necessarily. Just has a higher amount of protein. So then, fish generally, like I said, milk, egg, and various things like that. They are rich in proteins. Then, fat and oil. We have talked about different kind of oils, margarine. Nuts, things like groundnuts. You also have high amount of fat and oil. Then other classes of food, these are micronutrients, vitamins and minerals. And these areas are so interesting because they are required in small amounts. But when they are not there, they causes disease. In fact, we call them hidden hunger. The person appears well fed, but because there is a particular tiny nutrient which is deficient, it's manifesting some diseases.
Yeah, I was reading about iodine deficiency.
Yes, iodine is one of them. You understand? Iron deficiency.
So what are the best sources of those, micronutrients?
For example, now, if you talk about iodine now, iodine is a lot of the iodized salts. There is high amount of food supplementation based on technological advancement. So most of the salts that is packaged, that is sold in the market, they usually write iodized salt. Sometimes they add it to sugar, and then there are some seafoods. Seafoods generally also contain those iodine. Then another common one is iron. Iron is also common, especially it causes iron deficiency anemia. That is when the blood level is lower than what it should be. So when you have a child that is growing rapidly, for example, an infant towards 1 year, going to late infancy, or somebody that is even an adolescent, they need high amount of iron. And this iron is found in foods such as meat, even beans too. But red meat is a very good source of iron.
All right. So, doctor, I'm sorry to cut in. I'm talking about meat now. Something just came to mind. I've seen a woman, we're talking about children here and how to, breastfeed them. I've seen a woman, first chewing the meat. I mean, chewed the meat to be so soft. After chewing the meat and enjoying all the nutrients, then spat it into the mouth of the baby. Is that proper?
Well, those are some of the cultural.
So I just wanted to read it here.
There's a principle behind that we can take the principle, but I will not encourage the practice. The principle is that you want to chew it to bring it to a form that the child can easily take. If you give a child red meat now, a 7-month-old child, you won't be able to chew it.
Absolutely.
So the principle of trying to chew it for the child so that I can take it, the principle is okay. But health-wise, I will not encourage that. For example, there are some infections that the mother might be carrying. Take, for example, there is an organism called Helicobacter pylori, which is responsible for peptic ulcer disease. That might be the point at which it's introduced to the baby.
Unknowingly.
Unknowingly. Because the mother might even have it and it might not be manifesting any disease. So health-wise, I won't encourage that. But what you can do is that you can blend it. Blender is a very good alternative to do such work. So you can blend the meat, add it to food, and it will do the same work.
So, doctor, apart from the risk of the disease, I mean, how about the nutrients? Does it diminish the nutrients in any way? Because that day when I saw it, the first thing that came to my mind is, see, look at this woman. She has first enjoyed the meat, chewed the hell out of it, if I may say so, before spitting it into the mouth of the baby. So, does that chewing also affect the nutrients, apart from the health risks associated with it?
Definitely, it will affect because depending on the level of chewing. Because there's a way you can chew something that by the time you finish chewing it, there's nothing.
You chewed life out of it.
You have chewed life out of it. So definitely it will affect it.
Okay. All right. Thank you so much, Dr. Adeniji. And of course, to you, our distinguished viewers, thank you so much for staying with us. We'll take a quick break right now. When we return, we'll continue with the conversation. Stay with us.
There's no other animal as courageous and majestic as the lion. But with only 50 lions left in Nigeria, they may soon just be a memory. When snares are used for bushmeat, we rob the lions of their food and risk maiming them for life. So please, say no to illegal bushmeat and help protect the lions. Keep them wild and keep us safe.
Some people say animals don't laugh, but perhaps we don't give them a reason to. Our unique species of gorilla are only found in a small forest between Nigeria and Cameroon, with only 300 left in the wild. We cannot afford to lose even one. Traps and snares used in catching bushmeat often kills or injures gorillas too, driving them to extinction. And that, you agree, is no laughing matter. So say no to illegal bushmeat from endangered animals. Keep them wild and keep us safe.
Thank you for staying with us. This is Spring Clinic on Western Spring Television. We're also streaming live on YouTube at Western Spring Television NG. And today we are talking about child health and nutrition. And we see with us in the house Dr. Tosin Adeniji, a consultant pediatrician. Thank you, Dr. Tosin, once again.
Yes,
we were talking about, child health and, of course, some of the habits of children. Just before we went on the break, you mentioned something earlier. You talked about some children developing a kind of affinity for a particular kind of food, developing interest in a particular type of food and always tilting towards that. Now, how would you advise mothers and parents how best to build healthy eating habits in children?
All right. So when we talk about healthy eating habits in children, the first thing that must inculcate is balanced diet. Let the food be balanced as much as possible. So don't, because whatever you give to a child is what he will grow to love. And that's what he will grow to enjoy. For example, and whatever is available, or let me say, whatever is in the surroundings of a child, the child is likely to develop more interest in it. So if it's just snacks that is always available, the child will love snacks, he won't eat real food. So the first thing is that what food is available. And we must carefully choose what is available, what is accessible for the child. I will encourage more of natural food rather than refined food. Because a lot of refined food contains high amount of sugars and high amount of salt. And this may also, they also contain high amount of fat, and this may affect the child. If it's an adult now, an adult can control, oh, the doctor said I should not eat too much sugar, so he can decide that I won't take this. But a child will not, he doesn't know that information.
Absolutely.
So once he gets used to it, that's what he will be craving for. If you give any, if you introduce soft drinks early to a child, he won't. Is that soft drink he will be looking for?
Okay. All right, okay. Doctor. So now we're talking about. You talked about balanced diet. That the focus should be on balanced diet for the child. So let's break it down now. For an average Nigerian, okay, for a low-income earning Nigerian, for a typical day in a child's life, what would you advise as balanced diet for that child, for that baby?
Child. Okay, typically for a balanced diet for a child, I will just mention some common meals in our own environment or in our own setting. Just like I said before, cereals. For example, you give a child is taking pap and milk, can add milk to it.
In the morning?
In the morning. You can add moi or akara to it. If a child is taking bread, for example, bread should not be taken with tea. If you take bread, it can be taken with tea, but don't assume that you have eaten.
No, that's interesting.
You have only taken wheat and sugar.
And the same thing applies to adults.
Yes. If you look at the Caucasians, when they are taking their bread, there are so many things that are in between.
Yeah.
They make it so rich. Those are the things that bring life.
But here we are eating dry bread.
We eat dry bread. And sometimes you see a patient in the hospital, what did you eat this morning? Bread and tea. I say you have not eaten.
Whoa.
This child has not eaten. Bread and tea is not enough. Even though the child will have a sense of fullness, but there are so many other things that are lacking. And you discover that in our environment, those are the things, those are the food that people eat most times. Is that they give them bread or they give them noodles, which contain limited nutrients. I'm not saying that people should know it, so that the company will not.
Yeah, because people's mind, people will be wondering. So if bread and tea is not food, then what's it? So the question is, if they must take bread and tea, what should they add to the bread to make it nutritious? They must feed the child with.
For example, now, egg is good. At least egg will supply protein and maybe some other things. Okay. So they add all kind of things together. Some, if it's overseen, they add a lot of vegetables and things like that. So vegetables, carrots and things like that. We are not used to that kind of combination here.
Yeah, Nigerians will say we don't eat leaves.
But those are the things that actually make the food more
nutritious.
Richer, more nutritious. So another thing is, if you are taking rice, rice should not be taken alone. So rice is just cereal. Rice and stew is just cereal. So rice should be added with beans, can be taken with moi, can be taken with fried rice now. You have carrots, you have green beans, you have all kind of things, you have liver. All those things are making it richer for the child. And bringing it down to our environment, one common food that is very cheap that people can adopt, especially in young infants, is guinea corn and soya beans. It is very good.
What's the local name for guinea corn? Is it the one they call okababa here? Is that it? Is that the guinea corn?
Yes. I think they also call it dawa. That brown, reddish.
Yeah.
So that one now, you can, because if you look at a lot of commercially available food preparation cereals, I don't want to mention any trade name, but cereals that are sold in the market, they are made from all these things. Somebody just blended it, added sugar, and packaged it.
So you mean they don't add additional nutrients? Not as if they add.
It's not as if they are, unless if they add additional nutrients, they will specify. For example, some may be iron fortified, calcium fortified, and things like that.
But apart from that, the nutrients are inherent in those.
They are inherent. It's the same. So if somebody is from the low income setting, let him get his guinea corn. Let them get the soya beans. Ratio 2:1. The cereal should be more than the soya beans. Let them blend it, and they might add sugar or something to make it tasty, and they are good to go.
All right. So no matter the parents' income, they should still, try to give balanced diet to their child. Okay, yes. we are running out of time, but we cannot leave this show without talking about the mother's nutrition. Like we mentioned earlier, the first 1,000 days of a child's life are very crucial to the child's development. That's talking about the day from conception to age 2. Okay. So we cannot talk about that without, also talking about nutrition for the mother. That's the mother's nutrition. So what role does the mother's nutrition play in the development of a child?
All right, thank you for the question. So the role of mother's nutrition starts from during pregnancy. A mother must be well fed. If the mother is not well fed, it will affect the baby. If I right from preconception, if a mother is deficient in some nutrients, it can cause some diseases in the baby. Some congenital, we call them congenital abnormality, that a particular part of the body is not well formed because the mother was deficient in certain nutrients. And that's why if you look at the hospital, they give them folic acid, they give them all kinds of things, is to forestall such things. Now, if a mother is not well fed, if we also affect the baby will be small. We call them low birth weight. Ideally, the weight of a baby should not be less than 2.5 kg. Anything less than 2.5 kg at birth is low birth weight. So if the mother is not well fed, that can happen. And then as the baby is also growing, a mother that is breastfeeding also needs to be well fed, balanced diet, so that although the body tries to maintain the quality of breast milk as much as possible, but to sustain that, you also need to be well fed. Because over time, if the mother is malnourished and is severe enough, it can affect the quality of the breast milk that the mother is producing, which will eventually affect the baby.
The child. All right, doctor. I was also reading a research which talked about how it affects the cognitive, ability of the child. It's very important because sometimes I now start to understand why you see children from a particular continent or a particular region. We think they are not so smart, but it's not their fault because of the kind of nutrition they were exposed to. Their mothers were not well fed, so they didn't pass proper nutrition to the fetus after conception and during that period of pregnancy. So don't you think that's a critical challenge we are having here?
Yes,
in this part of the world.
It is definitely. It is definitely because about 80% of brain growth occurs during the first 2 years of life. In fact, during these 1,000 days of life you mentioned, from conception
to age 2,
about 80% of growth. So anything that affects nutrition or any other insult to the brain at this time can cause a permanent damage to the child.
So adults should make sure they make sacrifices to ensure that for that period, the child gets the best of nutrition. And one critical nutrition that a child needs at this age is milk. Milk? Breast
milk. And that's why we say feed with only breast milk, or let me say one of the reasons. Feed with only breast milk within the first 6 months, continue breastfeeding to 2 years. Now, I know that in our environment, most people don't breastfeed till 2 years of age. But even if you are not going to breastfeed with 2 years of age, you must know what to do to continue to fill that gap so that you don't limit the potential of that child. So we encourage, let them breastfeed till 2 years, but they can also feed on a lot of breast milk substitutes are available that are suitable for that age group. So that when it's not feasible for the mother to breastfeed at that time, then other sources of milk should be considered, especially when they are older.
But the first 6 months should be exclusive breastfeeding. So I also saw in one of the researches that after 6 months, exclusive breastfeeding is no longer necessary because breast milk does not contains all the nutrients after 6 months.
Yes,
because before now, some people have said that people can actually, have exclusive breastfeeding for 1 year, but I realized that no, it's not true. After 6 months, breast milk becomes insufficient to cater to all the nutrient needs of the child.
Yes. So there are, in fact, such example, because it's not all the nutrients that are present or that occur in high amounts in the baby. So once they cross 6 months, some nutrient deficiencies begins to show if they are not catered for. One of it is vitamin D. Vitamin D is not very high in breast milk. So a child needs extra supply of vitamin D, things like iron, because once they get to that age, they need to be supplied from us, and that's the idea of weaning diet. Those weaning diet must contain food substances that can supply those nutrients. Otherwise, because it's not about I fed the baby is full. Baby may be full and still be lacking in critical nutrients. And when these critical nutrients are lacking, some diseases thrive in such an environment. And permit me to divert a bit to this issue of vitamin D, because I know that it seems to be an age-long problem, but it's beginning to reoccur again because of certain religious practices. For example, now in the bulk of our vitamin D that we need in the body is gotten from sun. Like 75% is synthesized in our skin when the body is exposed to sun. But when certain condition makes people not to get exposed to the sun, for example, covering the body and things like that. And when that happens, the mother is deficient of vitamin D. They pass it on to the baby, and then they develop a disease called rickets. I'm saying this because people that do that, even though it's a religious practice and there's nothing we can do,
but it's affecting the health of the child. We cannot tell them not to practice their religion. But what you can do is that you should let a medical practitioner advise you on how to prevent that problem. Let me give you an idea. When a child has rickets, for example, that's when they have things like bow leg. Yeah, deformed bones.
Deformed bones, K-leg, and things like that. Dr. Adeniji, I really wish we could continue this conversation. We are totally out of time, and the conversation was just getting more and more interesting. I was going to ask more questions on that, but unfortunately, this is where we have to draw the curtain on the show today because of time. Thank you so much, Dr. Tosin Adeniji. Thank you for joining us. My pleasure. Adeniji.
Adeniji. I beg your pardon. Thank you, Dr. Tosin Adeniji, for joining us. Yes, and of course, Dr. Tosin Adeniji is a consultant pediatrician with the Uni-Osun Teaching Hospital. Spring Clinic was brought to you in partnership with the Office of the Chief Medical Director, Uni-Osun Teaching Hospital. Thank you so much for joining us this week. Don't forget, always remember, stay informed, stay healthy, and of course, stay safe. Daniel Emeka is my name. Bye for now.